Speaking about current hardship in cancer treatment, I would say there's a big issue between balance things, how to balance one aspect of doing efficient and potent treatment for cancer patient, and on the other hand, how to sustain his quality of life, his immune functioning, and so how not to deplete and not to destroy his vital organs. We see that the big industries are starting to promote different type of agents, more specifically designed, more targeted agents who have less toxicity and also probably the same type of efficacy. And here we can also see a big perspective, like one of the branches could be oncolytic virus therapy, which is of course very gentle, very non-toxic. And this could be a very good help in this whole multimodality design, yes, for the future perspective. Because the world is evolving and we are trying to step out of this whole turmoil of toxicities and this kind of there's a big psychological issue, we could also say, for many cancer patients. It's very hard to go for these toxic therapies knowing what will they do. There's a lot of fear, so we need more and more therapies which do not trigger fear to the patients, so they could feel more at ease and more happy about their new type of treatment. This is a place where oncolytic virus therapy should definitely step in. One of the modern trends is combining oncolytic viruses with immune checkpoint inhibitors, and here we can see that there are ongoing multiple clinical trials in this field. If we start dissecting this topic, why probably oncolytic viruses are so good in combination with immune checkpoint inhibitors, then there could be several key aspects what we should consider. One could be the topic about hot and cold tumors. There's this problem, mainstream problem in terms of cancer, that it tends to be very invisible to the immune system, and this means that the cancer will be cold. This term means that the cancer is not fulfilled with immune cells, because the idea is that if we want to eradicate cancer, if we want to destroy it, we need the immune system to help. So, and by this we see that many cancers, they remain silent or cold, and the immune system has not been alert and has not recognized it. Oncolytic viruses, they trigger the immune function, and by this many immune cells, they head to the place where cancer originates, and by this they will start infiltrating in this place. This is called specifically T-cell infiltration, and this is a process how the cancer turns from being cold to becoming hot. This is where the PD blockers or immune checkpoint inhibitors take their part, and their actions become even more potent. And this is how we get probably better, more sustainable results, this combination between oncolytic viruses and PD blockers. There's an issue that we all know with advanced type of cancers, and if you just apply one type of therapy, being called monotherapy, so say if we apply only immune checkpoint inhibitors, all the studies show and clinical evidence testifies that we have limits. So at some point the therapy won't work anymore, or the cancer becomes resistant, or it gets reversed. And this is why oncolytic viruses could be very beneficial in terms of trying to again remodulate this whole inner environment and not to let the cancer become resistant to this immune therapeutic agent. And basically the combination gives us better long-term effect, yes, and better sustainability of the clinical response.